Midway Specialty Care and Research Center, headed by infectious disease specialist Dr. Moti Ramgopal, opened a branch of his infectious diseases center on Carmichael Street in Georgetown. Dr. Ramgopal has pledged to bring U.S. specialty care to the underserved.
But when you read the papers every day, what do you see every day? Somebody dies of gunshot injury or a stabbing or something. And most of these patients probably die from an infectious disease complication. So the question I always have about Guyana is we have malaria, we have dengue, we have so many other challenges. So infectious disease is a huge challenge we have in Guyana. 1, 2, traumatic injuries, death, people dying very young from these disease states. So my short-term goal is to make sure this clinic is operational, take care of the underserved people, take care of people who are stigmatized. I'm a big believer in handling, when I moved to Fort Pierce 20 years ago, it's one of the poorest places in Florida. And it still is one of the poorest places in Florida. It's farm workers and taking care of the poor patients, taking care of patients who are unable to even have insurance to see a doctor. One of my overriding principles is to see every patient regardless of if they have money to pay me or not. And I think that's the philosophy of my organization, Midway Specialty Care.
As one of the lead investigators in the clinical trial cocktail for Regeneron CoV-2 antibody shown to reduce viral levels of the coronavirus and lead to improvements in symptoms, the same cocktail used on President Donald Trump while he was hospitalized for the virus, Dr. Ramgopal plans to bring similar clinical trials to Guyana.
So now that we're in Guyana, we're going to expand our services. And I also want to bring clinical trials and research to Guyana. I want us to start asking the right questions, analyzing data, recognizing what it takes to have a clinical trial, what's the time, the work, the strategy behind a clinical trial. When I look back at all the HIV medication in the market now and how much we have contributed as an organization, Midway Research Center, I think I would like to replicate that story in Guyana if I can. As I'm getting older, I think now that was my last chance to do this in Guyana. So I'm pushing ahead in that direction.
Midway Research Center, with Dr. Ramgopal as the principal investigator in clinical trials, has so far been recognized by name in 36 published studies on extensive research into HIV and hepatitis C infections. Dr. Ramgopal said that Guyana's medical care needs to evolve, catering for telehealth, utilizing social media platforms.
We're offering infectious disease services, HIV services, but it needs to evolve. There's a lot of challenges we're facing in Guyana right now. We need to evolve into telemedicine, telehealth, use platforms, use social media platforms to educate patients a lot more than what we're doing in Guyana.
For the Guyanese Diaspora News, I'm Jennifer Jabbar.